channel today. Today we are going to discuss about Purgative formula. So in previous video we have taught the formula for expel the superficial pathogen, and from today in this video we're going to talk about Purgative formula. Purgative formula, when we learn from the name of the group name of this formula, you have the function of purging. So the main function of this group of formula is to purge, to cause diarrhea, to make the intestine, to unblock the intestine, especially the large intestine. The purpose of diarrhea, the treatment method for diarrhea, the purpose is to clear or to reduce the internal heat. Internal heat or internal excess. We call the internal excess, it's actually the heat or the pathogen, two pathogen, especially the heat, something they combine with others. For instance, if the patient got internal heat and at the meantime the heat goes to large intestine, if the heat was combined with the stool, then it becomes internal excess heat. In this condition we use Purgative formula. Purgative formula, or the heat can combine with the stool. The heat also can combine with water, the fluid in the body, in the body, also can combine with the phlegm in the body or the blood stasis in the body. But that's in those we use different methods like activating the circulation or reduce the phlegm. We are going to talk in other video. So in this video we more focus on Purgative formula for diarrhea, for loose stool, to cause loose stool, to clear the internal heat. Our organs need to be smooth, so we don't want anything block the intestine. If they block, it will cause some diseases like stomachache, like all the heat if it go to the heart. It also can cause like unconscious in a severe condition. And in Chinese medicine, the theories or the Chinese philosophy, the heat, the internal heat and the stool, when they combine together, it become, we use the Purgative formula. But if they didn't combine together, so if we only have internal heat, we will have very similar formula we can use, like in previous video we talk about Yin Qiao San. Yin Qiao San we use for patients who attacked by external or from the environment, the pathogen, the heat or the wound disease, or the patient, the body condition was hot, so the cold pathogen goes to the body change the pathogen to heat. So in that condition we use Yin Qiao San. The patient's tongue is red tongue with some yellow coating or some coating. But here, when we talk about the pathogen was combined with the stool, that we combine something you can see actually. It's very similar. Here is the mesh. So as you can see from the mesh, the flame and the wood. So in Chinese philosophy, in Chinese medicine philosophy, we separate the flame and the wood. So we put them, we don't put together. We see these two are different stuff. So if we want to reduce the flame. How to reduce the flame for match? There's some different ways. You can blow them off, or you can. One of the most effective ways, if you take the wood off, there will be no flame. Such as here, if we take this wood off, there's no flame. So flame is not something you can see actually. Flame must attach to the wood, then you will see. So same as the internal heat in our body. The heat in the body is like similar to the flame, and the stool in the large intestine is similar to the wood. So how to clear the heat, or how to clear the flame, is to diarrhea. We use some formula to cause diarrhea, then the heat will be dramatically reduced. When we use the Purgative formula, we need to think about the patient's condition. If some weak patient, when we use this kind of formula, we need to be careful. Either the dose need to be reduced, or the period we use, the time we use should be shortened. Also, when we use the purging formula, we add some herbs to activate the qi circulation or blood circulation. This can cause qi deficiency or blood deficiency, especially for qi and blood deficiency patients. So when we use this kind of formula for this type of patient, we need to add something to benefit them or to tonify, to prevent something happen. When patients have internal heat, the patient may have unconscious in a very severe condition, may have poor appetite or stomachache, distending feeling in the stomach. It's very important, once we use the Purgative formula, the patient may cause diarrhea, and after diarrhea, patient may recover very quick. But after the formula, after the heat had been reduced, it doesn't mean the patient was healed automatically. We need to think about the patient's digestive system. That is the digestive function coming back or not? If it's not coming back, we need to use some formula to tonify the spleen, to tonify the digestive function, to make the digestive function better. And also, after the patient accept this kind of treatment, after the stool was gone and the heat was reduced, the patient may feel, especially for the appetite may be better, but at this stage, the patient should not, or it's not suggested eating too much or drinking too much. Otherwise, it will cause food stagnation as well. And when food stagnation would cause, the patient may be another heat. The heat may it will cause another internal excess heat again. So as we took all the excess internal heat causing internal, we use the formula. Most of the herbs are cold. The property of the formula are cold. In this kind of patient, they also may be sweating, but this sweating is not sweating a lot. Sometimes sweating, sometimes not sweating. The reason is the internal heat was already consumed some fluid in the body. so the body actually got indeficiency. The patient didn't have a lot fluid for sweating. The sweating can become and goes. And one of the most important signs of internal heat or internal heat combined with the stool or intestine is from the tongue. The patient will have red tongue. The coating is a thick yellow or yellow greasy coating. If the heat is worse, the yellow coating can be dark yellow or even brown, or sometimes even like black brown, like charcoal. And as the heat become more and more, the patient that got indeficiency, the fluid was consumed a lot. So the patient will have the indeficiency, and for a later stage, on the tongue we can see there may be some cracks or some dark spots. The patient may be thirsty, unconscious. And this patient, when they have the stomachache or abdomen discomfort, it's kind of pain. It's kind of pain, but this kind of pain is different from qi stagnation or edema in the stomach. So when you see from the stomach, it didn't have to be something you can see, but when you touch the stomach, patient can feel that he doesn't want to be touched. He doesn't want any pressure on the stomach, and he feels worse when you press. Nowadays, because of the drips, and sometimes the drips, sometimes the patient got the internal heat and stomach abdomen discomfort. They went to the hospital. They use the drips. They use antibiotic, and these medications are called improperty. So it may change our body condition. It can add the fluid. So the patient's fluid insufficiency or fluid deficiency is not that obvious. But at this stage, what we can see is from the teeth. If the patient's teeth is dry, it also indicates the insufficiency due to the internal excess heat. Because sometimes they use antibiotics, sometimes they use drips, can change the heat. So when we see from the tongue, it doesn't seem to look hot, or the coating is not like yellow or not like brown. Sometimes like slightly yellow or even white. But when you see from the teeth is dry, and sometimes dry as the dry bone. That indicates insufficiency and excess internal heat. Thank you for watching our video today. For more information, you can visit our website. In next video, we're going to talk the specific Purgative formula.